This is Dr. Christopher Carrubba here with TrueLearn, and today I want to go through a breakdown of a step one question in order to help you with your test taking skills and ultimately improving your performance on this test. When I'm going through questions, one of the biggest things that I like to do is to convert answer choices over. And what that means is that you'll see with step one and eventually step two that a lot of questions that you're going to encounter are second and third order questions. Rather than asking you something outright, what's the diagnosis, and listing off a bunch of diseases, you could see a question like this where you're using the pathophysiology of each disease as an answer choice. And where I've seen students panic on this is they get to the end and they say, well, how can I even answer if I'm not even able to figure out what the disease is? And what you can take advantage of is that you can use these answer choices to work backwards. So what I always like doing when I'm starting off with a question is I like to read the last sentence first. Which of the following is the most likely underlying cause of the patient's symptoms? And then I like to look at each answer choice and try to convert that over to the disease that it may be. Now, for those of you that are following along and want to try this yourself, you can go ahead and pause this right now. Otherwise, we can hop in and start thinking about what each one might be. So rather than seeing accumulation of misfolded protein within hepatocytes, I can convert this to alpha-1 antitrypsin deficiency. Answer choice B becomes Wilson's disease. Answer choice C seems like it would be pointing towards hereditary hemochromatosis. However, this is not actually the pathophysiology of this condition. It's actually a junk answer that doesn't line up with anything. With that in mind, I've already been able to get rid of that choice. Answer choice D would correspond to non-alcoholic fatty liver disease. Answer choice E would be more of a secondary hemochromatosis, and answer choice F actually does line up to hereditary hemochromatosis. With that in mind, I've now been able to give myself a few benefits. One, I know what my possibilities are, and I'm going to be able to think through that as I read through the stems. I also have an idea of what those conditions look like. I can think about what a typical question stem about alpha-1 antitrypsin deficiency shows me. I can think about a typical question stem for Wilson's disease. And all of those things, the more that I can do before even jumping in is giving me more benefit. It increases the chance that I get the question right. It increases the chance that I pick up on key details. It's also just going to make me a lot more efficient. So as I hop in over here, we see that he's a 51-year-old man that's coming in due to history of joint pain. Right off the bat, that is probably pushing me towards one thing. If you want, maybe you're thinking about the same thing there, but we'll keep moving on. The pain is minimally improved with over-the-counter pain relievers. We also see that he has fatigue, generalized weakness, and a loss of libido during this period. Again, with each of these sentences, I'm trying to think about what answer is it pushing me towards, and are there any answers that it's pushing me away from? We notice that he was recently diagnosed with type 2 diabetes, and then also has anemia secondary to beta thalassemia minor. We can stop on that for a second. We noticed that there was an answer choice that lined up with frequent blood transfusions. However, that's just a distractor because patients with beta thalassemia minor do not require blood transfusions. So we know that answer is gone as well. We have a family history of liver disease in both the father and the brother, which could make us, think about a couple answer choices here. He doesn't smoke, doesn't drink alcohol. We see his BMI is 22 kilograms per meter squared. That for me is helpful in two places. One, it makes non-alcoholic fatty liver disease less likely. Two, it makes me go back and think about that recent diagnosis of type 2 diabetes, because one thing that you'll see is that when you're seeing diabetes in somebody with a normal BMI, there's only a few conditions that that's going to line up with, one of which is actually here on these answer choices. So taking all that together, we work through, we see hepatomegaly there, and now we're thinking about that underlying cause. And maybe some of you know this right away and you can quickly answer it. It's all lined up, but let's pretend that you don't. Here's what I would do. So we know answer choice A was alpha-1 antitrypsin deficiency. Let's think about what that typically looks like. It's, a question about someone that, develops emphysema at an early age, and or they might have cirrhosis at the same time. So do I feel good about picking that? No. Maybe it could fit the hepatomegaly. Maybe it could fit the family history of cirrhosis, but we don't see any personal or family history of lung disease. I don't know how I could connect that to the type 2 diabetes, and it wouldn't explain the patient's joint pain either. So we can move on from that. Answer choice B, we said, lines up with Wilson's disease. And while that certainly could cause hepatomegaly and cirrhosis, again, my problems here, the patient's a little bit too old. Most patients with Wilson's disease will present before they're 40. And then I have a hard time with this because Wilson's disease does not typically give you joint pain, nor does this patient have any of the other features of Wilson's disease. They don't have personality changes. They don't have tremor. There isn't any renal involvement being shown. And I can't make the connection either with Wilson's disease to diabetes. It just doesn't affect the pancreas. So we can move on from that. We already established that C just doesn't line up with anything. We also have established that non-alcoholic fatty liver disease is unlikely given the patient's BMI. And it's hard to make that connection to his joint pain, his loss of libido. Wouldn't explain that as well. We've now established that frequent blood transfusions wouldn't work because he doesn't even have a condition that would require blood transfusions. And that leaves us with hereditary hemochromatosis. Now, you could just pick this because it's the last answer standing, but I do still like to think through it and make sure that I have good reasons to pick it. So let's look at it all. First and foremost, the age works. Most patients with hereditary hemochromatosis, men at least, present between ages 40 and 60. 2, the joint pain, the loss of libido, that could fit in as well. Iron deposition in the joints causes arthralgias, while iron deposition in the pituitary can disrupt the normal endocrine system, leading to loss of libido. Does it fit with the type 2 diabetes and a normal BMI? Absolutely. Iron deposition in the pancreas can impact my production of insulin, thereby leading to that. So that certainly fits. It also fits with the patient's hepatomegaly as well as the family history of liver disease because of iron deposition there. So not only do were we able to feel good about eliminating all of the other answer choices, but we were able to focus on enough details to realize that this is the correct answer choice as well. And one last thing to point out, when I'm studying these questions, I always like to look at the percent corrects on this. And, you can see right here, a lot of people miss this question, probably because they knew that this was hemochromatosis, but maybe did not remember the pathophysiology. How you're going to study always depends on why you missed the question. If you're someone that wasn't even able to realize this was hemochromatosis, spend a little bit more time looking through these details and really making sure you understand the presentation. On the flip side, if it was just something related to the pathophysiology, I think you're going to be better off, just really focusing on that, bit and really trying to understand the exact reasoning behind that. So hopefully this was able to give you a lot of skills that you can take forward and you use on other questions and, again, improve your performance. And, look forward to giving you guys more of these tips and doing more question breakdowns with you as we move forward.